Hello, everybody. Welcome once again to scanO Cafe. Today, we have one of the industry veterans with 32 years of experiences in the industry. We welcome you, Dr. Shashikiran. Welcome to our cafe.
Thank you. Thank you very much.
We are very happy and proud to have you, not just because of your immense experience of almost over 3 decades, but also me being one of your students and having guided in all the things that we have done so far. So, we have a list of things that we will be delving into today. But to have a context in this episode, the conversation will delve around the differences in dental education across all the states. We'll also explore how teaching methods and curriculum have evolved, and of course, the role of AI and technology in modern dentistry, plus also the gaps in teaching and the challenges that you have seen across 32 years, right? So, how about, Doctor, we start with your dental journey? Can you share a highlight of 32 years of your journey in dentistry and education? Also, you've been living and working across Karnataka, Madhya Pradesh, and Maharashtra. How has it shaped your view on dentistry as a curriculum and also the practice?
Thank you very much, Dr. Vidhi. I am here. I have passed my graduation in the year 1989 and then the post graduation in the year 1992. Those days, the dentistry stream has been taken up only from the boys. Those days, the boys are more compared to a girls. Nowadays, the scenario itself has changed. Now, most of the people are the girls than the boys. So looking into the scenario of 89 and 90s, the dentistry is not advanced that much of a things. Now, as the year passes on, the dentistry is taking up its zoomness. Now, the teaching and learning what we had on those days is like a white blackboard teaching and all the things. There were hardly any sort of an computer which has been introduced into the dentistry and all the things. Everything has been taught extempo. The teachers used to give us all the details one to one roughly. Nowadays the system has been changed to say all the things will go with a PowerPoint or with an internet based education system or any content things which is happening. Looking into this scenario, I have completed my BDS and an MDS, followed by I worked in the place of Karnataka, where I belongs to a place called as Davangere, where that time all students used to take the teachers as their mentors. Whatever the teachers used to say it, definitely we used to follow it. And also, if the things have been given, it will be done on that day only. It has not been kept on the next day, next day, and other things. Nowadays, the scenario has been changing. The students are not like that. Students kept changing the views about it. They, even if you ask something, they will give the reply maybe tomorrow, maybe day after tomorrow, like that. This is how the system has been changed. From the place of Karnataka, I moved down to the place called as Madhya Pradesh, where I was working in a place called as Bhopal. In Bhopal, once again, the students are, if you look into that, compared to an place called Karnataka, Madhya Pradesh education system is not that good. The students are not that highly interactive about an academics or a curriculum which is there on dentistry. They are more oriented towards other aspects of the dentistry, not exactly on the theoretical part of a dentistry as such. Moving out from the Madhya Pradesh to an Maharashtra, the working culture is good. Students are good. Once again, to say here, girls are more than the boys. Once again, to say girls' attention in the class is much more than the boys. Boys won't take up the things seriously. Only girls will take up the things in a serious way. Nowadays, the education system is too highly advanced, where if you look into an e-content and all the things, students are much versatilely know the things than the teachers. That is why the teachers has to keep their interest on e-content development. in the future, so that we can go with an students to talk to them in a proper.
It feels like we've peeped into the past.
Yes.
And I have seen a few things of the present, and later on in the episode we'll be talking about the future. But very two important aspects what you just mentioned. First is the change of gender roles what we have seen, from the admission of a lot of male doctors or male students becoming doctors, to 80% of female students now being enrolled in the institute to becoming dental surgeons. And the way the attitude of students have changed, right from delivering their assignments on the same day to procrastinating or maybe having a different attitude towards this stuff. Can we throw some light on what trend or what factors played a role in changing that gender role from a lot of male taking admission to females in dentistry first? And second, as we were just speaking, right, when we see high up in the evolution with respect to hierarchy, still, since it is a lot of female doctors in the nation, if we talk about India, yet high up with respect to the management, whether it is any association or say council or just somebody who takes decision, we don't see so many female doctors up, right? So what do you think are the factors for that?
Mainly the reason is in dentistry, the girl student will take up the dentistry mainly because of they wanted a sort of a prefix like doctor. In addition to that prefix, they are not much oriented towards the dental practice. They are much oriented towards their matrimonial things. The things are, if you have a prefix of a doctor, they will get, the illusion is they, if you have a prefix of doctor, they will get a good boy in their future. That's why these people will be looking into that. Definitely, if a girl wants to grow up in their academics, definitely the girls are better than the boys, because the workload which they will take it up is much more than the boys. Boys won't take it up seriously, but girls will take it up seriously. That is why nowadays, if you see it in a logical way, most of the prominent places ladies are taking up. Like, for example, now the government of India is also promoting more of a gender based female genders than the male genders. Even in our university, present university, we have in a prominent places more of a females than the males. Maybe in due course of a time, it may goes to be an equal male versus a female.
in the industry,
in the industry of teaching, in the industry of teaching.
and how is the perspective of the gender, if not equality, right, equity, with respect to in practice also we see the same thing of male doctors being more efficient and regular in their practices versus female doctors?
The reason is that only females dentists will have lot of other things to do it, other than males will have concentrate upon the working. Females, in addition to the dental clinic, they have to look about the natural things like maybe in household things, maybe their kids, maybe their whatever the other things. They have to look into that. That is why there will be a downward things about a dental practice. They have other things to do it. That's why they are not that much keen in a dental practice than the males. Males, if you look into that, they won't look for all these things. That is why they are very keen on the practice.
I don't know, I might be biased, but
Yeah.
do you think is that one of the reasons of why we are not able to create some innovative revolution around the basic problem of awareness in the country? Because if we see the ratio of WHO, right, we have good number of dentists in the country for our population, yet when it comes to the oral health index, we are not great. I think we are among second or third worst oral health condition countries. And the problem is not having good doctors. We do have good dentists, yet we are not able to improve the oral health score. I understand the population is massive, but what factors do you think are missing out? What is that gap between the problem that we have, the burden of oral diseases, and we have a great supply of dentists? Where is the exact problem?
See, if you look into the population wise, the things are all metros are urban. There are too many dentists we have been located. Then in an sort of an villages or in an taluka places, the dentists are very less, where they won't get a proper treatment. Even the education and motivation for those people are very less. Henceforth, they won't come to the clinic. How many we are going to treat in a metros or in the town? Maybe very less compared to the people who are staying in an rural areas. Rural areas, the people are more. There, exactly, the dentists are not taking care of their education and motivation and then their treatment. That is why whatever we do, even though there are dental colleges are more, even though there are dentists which are more, but things are, everybody wants to saturate in a place called as a good place where it should be a good town, it should be a good metros. That is why this population versus this is going to be, it is standstill like that.
But even with the great infusion of dentists in tier 1 cities,
Hmm.
I don't think we can say that the oral health of all the individuals in tier 1 is up to the mark,
Yes.
right? So there is some gap in awareness and seriousness about oral health and how is it connected to the overall health, even in the educated and elite class in tier 1 where there are so many doctors. So do you think with the infusion of technology, yes, we have been able to make some dent, but there's a lot what we can do as practitioner, and some of those learnings could be taught to students while they are in college?
Definitely, yes. If you look back when I have graduated and postgraduate, the awareness of the dentist is very less. Even if they are rich and all the things, they never used to come to the dentistry. Nowadays, if you look into that, everybody knows about the dentistry. Not only about a dentistry, the branches of a dentistry also they know. Each department, the patient started asking if they wanted to have a gum disease treatment, they will say we wanted a periodontist. If they wanted to have a crooked tooth or a malaligned teeth, they themselves will come to the hospital asking for an orthodontist. Like that, the awareness has started in to say maybe in downline, maybe another 5 years or 10 years, we may get a good patient's flow to the all the dentist. We can work it properly.
Mhm. As such a senior veteran, right, being into industry, what are your top three pain points that you would like to see changes happening in? Could be curriculum, could be the way dentists pursue dentistry, because I've seen a lot of practitioners just limiting it to symptom based rather than going deeper into the root causes and seeing it into holistic manner, or maybe something else. So if you can mention the top three pain points that you've in your last 32 years.
Like previously, the doctors used to attend only the chief complaint. That is the previous situation. The things are because everybody wants to get the treatment of their chief complaint. Nowadays, the scenario has changed. Nowadays, the education system in the dental colleges have changed. In the education system in the dental colleges, we are taking as a patient as a total holistic treatment. Like whatever the patient is having, everything has been diagnosed, and then we are giving you an option of whatever the treatment you wanted it. From A to Z, we are going to give it. Some patient will take up the entire treatment. Some patient, even though if they have financially good also, maybe they may not be having a time to get the treatment. Because of the time constraint, they may not take it up. But nowadays, definitely, if you look into that, it is growing well. Now, if you look into that, implants, dental implants, previously, when I passed out during 92 or something like that, hardly we used to see about a dental implants. Patient never used to talk about a dental implant. Now, if you see it, most of the patients are knowing about dental implants. That's how the science is been advancing.
Can you help us with a split, if possible, of as dental surgeons, we would tell them A to Z, whatever treatments which are required. But as you mentioned, some will go for all the treatments and some will not go for either because of financial restraints, time restraints, restrictions, or whatever. What is that split?
If you say about a split,
Hmm.
you can say around 30%. Right now, I can say 30% will go for definitely all the treatment, they will be taking care of it.
Hmm.
But another 70%, they may not be going. It may be because of an education system,
Hmm.
or maybe because of financial constraints, or maybe because of once again, the time is the problem. That is why those 70% people has to be attracted nowadays. Then only the dental component of their health is going to be good in future. Definitely, they are now in India. The scenario is changing regarding a dentist.
Again, as a senior veteran, right? Do you think the DCI, now it has dissolved and we have NDC, but let's not name any council in general, have done justice in evolving the curriculum at a rate which it should have, with respect to what we see the evolution in other sectors. So if you think justice has been done in evaluating it, why? And if no, why?
Definitely. Now, Dental Council of India, we cannot say that Dental Council of India is not putting up the things. Everything they are doing it. Now, to increase the dentist ratio, they have come out with so many dental colleges, wherein the good dental colleges have been given a credit over there, wherein the Dental Council of India is doing a good job over there. The curriculum is kept on changing it. They have given a liberty for curriculum changes in the dental in some universities where they have a good university things and all. The basic curriculum, whatever they have set in a Dental Council of India, is definitely a good thing. Good thing.
Mhm.
Nowadays, Dental Council of India is now they are in a verge of taking as a National Dental Council. Maybe in due course of a time, National Dental Council comes into the picture. There may be a little more higher up in the curriculum.
So we think that the evolution of curriculum has been justified, but I think the speed could have been faster, or are
So
we doing
in
good?
India, we cannot have this much of a speed. It should be a faster, because India we won't take up the load of faster. If you are going to be a faster change in that, it may not affect the population. We have to have a slow and steady progress. Then only we will achieve something. Dentistry, because it is not an emergency where the patient will have some problem.
Mhm.
It is just a disorder where patient has to be educated, motivated to get a treatment.
Hmm.
That's how the dentistry works about. Emergency things, when it comes, definitely the patient will come over there, they will take it up. But some of the things like malaligned teeth. Malaligned teeth, if you say so like that in a village side, if they have a malaligned teeth, they may not come for a treatment. They say that it is okay with them.
Hmm.
But if it is the same thing, if it is in a place called as a town or in the city side, definitely malaligned teeth will get a treatment. It all depends upon a variation in the areas which we are doing. That's how the dentistry goes on.
Correct. But I think with infusion of startups, right, multiple startups, at least, especially in the mal-aligned sector, and the kind of awareness that they have created, I think the attitude of people is changing even towards non-urgent or non-emergent things like malalignment, or even say getting a fracture repaired. Say, for example, even class 1, class 2 fracture where there is no pain, but it is kind of affecting the aesthetics. The behavior of patients is changing.
Yeah, definitely. Definitely, if you look into that, the behavior of the patients are changing nowadays, because there is lot of social medias which is come into the picture. Previously, there were no social medias where they were not aware of what treatment they are to. Now, because of the social media and also because of a Google,
Right.
that's how.
Right. And then with this part, we come to the final things of the infusion of digital dentistry and AI in dentistry. Because when you mentioned that the PowerPoints of students are very different than the staff, of course, we can't discount the fact that they are using AI to make their PowerPoints. They are using AI for the research. They are using AI for, in fact, anything, right? Even drafting a message has been refined on few of the LLMs and they're being sent. So, what are your views on the speed of infusion of AI? And do you think there should be a curriculum, maybe a chapter or so on the infusion of AI in dentistry?
Definitely, without AI, nothing will work nowadays.
Hmm.
It is very easy. There is no need of digging into the literature. At least, if you say around 10 years back, at least computer Google, if they put it on Google, at least Google used to give some sort of a maybe a 20 pages things where the student used to at least they have to read. Now, after AI come into the picture, it gives you point wise. Since it gives you a point wise, students are very easy. They will get an answer instantly.
Mm.
That's how AI is working it. Of course, nowadays, now everything goes with an AI. You can say a digital. Now the dentistry is going with all digitalization, like digitalization of impressions.
Mm.
Then even crown, when what we prepare, those crowns are also like it will be like we say it is called as an CAD CAM, computer assisted uh, designing and computer assisted milling. Instantly, the patient, when we do the crown preparation or the tooth preparation to receive a crown, we can do the crown preparation followed by digitalizing the crown.
Hmm.
Then if you feed to a computer, you will get a crown over there. Just to say, if the patient waits for 2 hours, we can cement the crown and then we can send it. Previously, it was not like that. After crown cutting, we have to take an impression with any impression material, followed by making a positive one. That is, we say it's a cast. Followed by that cast has to be sent to a lab. The lab has to prepare an wax pattern. Wax pattern has to go for an investing and all. Then it will be going for a casting, then trimming. It used to have around 4 or 5 days to come for a crown. Nowadays, if the patient is willing to pay little more money, if they are going to be there in the clinic for 2 hours, we can instantly give a crown, which is much more exactly fitting as per the norms of the contour of the tooth than previously what we were doing it on the cast. This is how the digitalization of the things dentistry. For this, once again, the staff has to get trained. If they don't get trained, then they cannot compete this world. That's why the competition, if you want to face the competition, every year the staff member has to get their knowledge much more by attending a continuing dental education programs, conferences, and so forth.
Mm. No, it is really wonderful how the evolution of dentistry we've seen in last 150 years, the speed of changes from last 150 years to 100 and then last 150 years. And I think now every 2 to 3 years we are seeing a massive development and changes, especially infusion of cloud-based technology or AI technology for not just in clinical procedures but also the awareness preclinical and postclinical. So, for example, I think when we have to make a patient aware, we have AI for that. Once the patient is aware and motivated to get the treatments, then we have AI. And also to engage the patient post the treatment is done. We were doing a survey, and hardly less than 12% of doctors are able to engage their patient post the treatment has been done,
Yeah.
because otherwise once it's everything is good, they would not visit it back until or unless they have some secondary issues with the existing restorations or a prosthesis or whatsoever. So I think these two things also, which is the pre-treatment and the post-treatment AI, is also on the rise and making a difference. What is your opinion on
Yeah,
that?
definitely. Dentistry, it is not like once you take a treatment and then forget the dentist. It is not like at least every time, maybe once in a year, they have to come for a checkup. Now, AI has started the things. Now they have come out with an pre-treatment, how the things happen, and then the post-treatment, how the things are happening. This is definitely a good thing. Maybe in due course of a time, maybe downline, maybe another 1 or 2 years, AI will take up its zoomness. That's what I can say.
So what advice would you give to dental professionals who aspire to pursue a career in academia?
In academia, any staff member wants to pursue it. Definitely, my view on that is whatever you are learnt, that is not the end of it. You are supposed to go on increasing your knowledge by either by reading or by any sort of an material, clinical material which you are going to get into that. Maybe you can say you attending the conferences, you have pre-conference courses wherein you can hands-on courses wherein you can improve your skill also where nowadays the academicians, what is happening is because of a time constraint they may not read the things of recent literatures. Whatever they know the things, they come to the clinic, they will say, they will discuss it. But if you look into that, students are much more highly knows the subject. If the student is really good, definitely they know much more than the staff member. That is why staff members, if they wanted to become a good academician, every day I say they have to go for reading up the things to get a recent technologies, recent techniques. Thereby they can improve upon their skill as well as an academic curriculum.
Perfect. I think that was a great advice for somebody who wants to pursue your career as an academician, coming from a veteran with 32 years of experience in the field. And if you have any more questions, not just in your career, in the field of your career as an academician, but also as a student who is pursuing graduation or undergraduation or post graduation, or somebody who just does a practice, do not shy away in asking the questions in the comments below. And we will be coming back with one more episode of different topics. And do suggest if you want to listen more about certain topics. We are here to talk about everything and anything in dentistry at scanO Cafe.
Definitely we are also with scanO cafe. Whatever the questions will be posed, definitely we will be looking into that.